Welcome to the West Central Ohio Dairy Luncheon Series. This is the first one of 5 for the... All right, so with that, we'll go ahead and get started here. Our speaker today is Dr. Mark Hardesty, our local veterinarian that concentrates on dairy cattle. So we appreciate him coming today.
Today's topic, Jeff asked me to talk. I mean, there's a whole battery of things that I have talked about. But this topic of parturition, calving, always comes back to something we want to talk about because it's so much changes what our success level is on the farm if we have a good crop of calves. And the ones that we tend to lose at birth are the ones that we didn't want to. So I have this slide set from Dr. Gustavo Schunemann. And Dr. Schunemann is from Argentina. He's our extension dairy veterinarian. He has German heritage, and his Spanish is much better than my English. So I'm not going to criticize him, but there's some places in here where, as a translator, which is what he does, there's some people that are fluent in foreign languages. There's some that translate. He translates, so there's some things that don't quite fit. So we'll have to correct his English from time to time. We've used this particular slide set for calf management and calving training on a lot of farms and a few small sessions as well. We have 2 doctors in our practice that have some Spanish-speaking abilities, and they'll go to farms and put on this class. We can also do it in English, which we're doing today. So that's where this comes from. And in our new style of teaching, we have to teach to the test. So we now give you the questions, then you watch the lecture, and then you see if you get the questions right. And I hope you can do that probably right up front. So here are the questions. How many calving phases are there? Did you cheat? You looked ahead? Yes, that's right. 3 is right. We'll go through all of those. But understanding them is important. And if I can understand how to move this. Okay, which shows a natural birth or what I would consider a normal birth? Which one is a normal birth? Say B. That's a good thing to say. Okay, are the chains correctly attached on the calf's feet? No. That's correct. That's correct. We'll talk about why. Is this front or rear legs? Okay. And if you couldn't see right here as the slope goes up towards the hock, if you could only see that much, is there a configuration that could be front feet? Yeah, there is. It's not a good one because it'd be upside down with the head down, and then it could be the front feet. We'll talk about how you could figure that out, what it really is. How soon after birth should colostrum be administered? Then 3 hours, you bet. We can talk about why too when we get to that. Okay, so the outline of this talk, now you got all the questions right, I guess you can just leave. There might be a little bit more though to glean out of this. So the outline is we're going to talk about anatomy, the calving phases. So a little bit of anatomy. You're standing here looking at the vulva. This is what's going on inside. So you have the vagina or birth canal. The cervix, which hopefully at the time of calving has relaxed and completely effaced. So this will be wide open. There's the gravid horn of the uterus, which one's going to be significantly larger than the other. The non-pregnant horn is going to be more enlarged than it is when you breed them, but it won't be teeny tiny like this. It's going to be larger than that. And the bladder is generally of no consequence during birthing, unless there was pressure on the urethra and you relieve the pressure and they fill your boot. But that's kind of a minor thing, happens occasionally. Okay, as we talk about this anatomy, it's very important that you look at the pelvic bone where it's located, and they didn't put the top part of the pelvis in there as well. But where it's located as we go through the different presentations that are inappropriate for natural birth, that becomes a block. So you have to work down in the belly to make a manipulation because there's not enough room to move anything up here. There's posterior and anterior presentations. They're both considered normal. People used to get excited about it's coming backwards. Yeah, 20% of them do. That's just the way it is. And when they're in anterior presentation, this wedge with their head works a little better to dilate the cervix. So cows have less trouble having a calf. It's an anterior presentation because in posterior presentation, the feet are a pretty good wedge, those rear feet, but then there's the hips. And the hip doesn't form a wedge like the head does. So in the introduction to calving, it is a natural process, but it requires some attention, has several steps in that, and there's critical points to pay attention to. So go back to the 3 phases. Somebody said there's 3. No cheating, Andy? Yeah, 3 phases of calving. The first one is uterine contractions and the cervical dilation. The second one is expulsion of the calf. The third one is expulsion of the placenta. So let's talk about the phase 1, and they're getting ready. You all recognize this because you've seen it many times, but you realize that every cow is a little different from each other. And they take on a few of their own characteristics, but it lasts for 2 to 6 hours, might even be longer in heifers because they've never done it before. It really bothers them to have to go through this process. They're nervous, they're walking, they're laying down, they're getting up, they might kick at their belly, they'll urinate small streams quite frequently, their tail's up, their udder is usually full, there should be enough oxytocin release from the uterus that their udder might be streaming milk. That never happens if you have orbicele in them. But it's one of those things you're going to see them flush. And then at the end of this process, you're going to see the water bag or the amniotic sac. That'll protrude from the vagina. And you know at that point that phase 1 is complete and the calf is up in the cervix. So that's what that looks like. You know what that looks like, but you're going to see the amniotic sac. So that's the end of phase 1. And then how do you know if you need to intervene after that? Phase 2, the calf expulsion lasts for 1 to 3 hours. It could be double that in heifers. They're going to continue this laying down and getting up. There'll be abdominal contraction, and the calf is in the birth canal. Feet and head visible. Feet first, of course, and everything being normal. So that's how fast that can happen, but let's talk a little bit more about that. And then expulsion of the placenta takes 8 to 12 hours. Anytime longer than 12 hours, we consider it retained placenta. And we could talk a long time about why we have retained placenta. It's essentially a failure of the immune system to reject the placenta and have it shed. And there's a lot of reasons that happens.